tax hikes. Etymological or real? Here now, Christian Weller, Senior Fellow at the Center for American Progress, Associate Professor of Public Policy at the University of Massachusetts, Boston, and Dan Mitchell, Senior Fellow at the Cato Institute, and author of Global Tax Revolution, The Rise of Tax Competition and the Battle to Defend It. All right, let's get to the bottom of this. You both heard Austin there talking about taxes. Dan Mitchell. He's saying that an increase that goes to medical device companies or drug companies, which they pass on to consumers, is not a tax on regular Americans. Is he right?
No, he's completely wrong. Companies don't pay taxes. Companies merely collect tax. Any tax levied on a company is paid for by either workers, consumers, or shareholders. There's no ifs, ands, and buts about it. And when Austin was at the University of Chicago, he would have given you exactly the same answer as I'm giving you now. But he's working for an administration that's continuing the failed Bush policies of big, wasteful government. And so he has no choice but to try to spin you and to try to spin your viewers with an assertion that is absolutely nonsensical. They're raising taxes on average Americans, and this is just the beginning. We're going to see much higher taxes in the future if the government takes over health care.
Christian, do you think, I mean, just logically, as someone who might take a drug, right? The fact that the drug price would go up 5 cents to take Lipitor, let's just say, because Pfizer got an increase of 10 cents in tax and they pass half of it along. As a regular person, I do view that hurts my standard of living. It increases my cost. It's hard to say that isn't an increase, isn't it?
Well, I mean, the question is really whether the companies will be able to pass on those things. And there's two issues. One is whether they pass it on, and if it's passed on, if it's considered a tax on the individual. The most important thing is here that the economic model that Dan would like to refer to is like the initial part of a textbook economics, but that's not how the drug markets and the medical markets work. They're monopolies largely, and they make enormous profits. So part of the taxes.
Well, the drug companies do, but not the device companies or the insurers, both of whom would be paying this too.
They're often there's enough slack in there, and the argument here in the healthcare reform is meant to increase competition. If you increase competition, it's going to be much harder to pay for the companies to pass on those taxes. So. The other part is, at some point, you have to face the fact that we already cover a lot of the costs that we're talking about. We're just doing them very inefficiently. So we're just simply shifting costs within the health insurance and within the healthcare market. So it's very hard to see how this ultimately ends up being a tax increase for ordinary Americans. I mean, this is all a discussion over making the whole market, the healthcare market, much more efficient. I mean, 2/3 of the healthcare reform, for instance, would come out of reallocating of funds rather than some fee increases.
Well, there is a hope, right, that we're going to get $600 billion in cuts. Now, that's a separate conversation, obviously, from this one.
Over a 10-year period. I mean,
right, but
this is,
I don't want to get into whether those are there or not in this conversation. But
that seems like a reasonable amount from all the estimates.
Well, it sounds like we could do even better than that. But as to whether we can actually achieve it, just politically is a separate issue. But Christian, let me just ask you, if you were advising this administration, would you be deeply concerned that they are saying they're not going to increase marginal tax rates for people at the top above where they were under the Clinton years, and they categorically will not raise taxes on people making under $250,000? It just seems like when their own projections say that their spending is going to exceed revenue for the next 10 years, they could end up in a really bad spot, couldn't they?
Well, I would be worried about the legacy that I was left with, the enormous inefficient policies like the massive tax cuts on top income earners that didn't do anything for the economy.
Right, but Christian, I'm just saying right now in terms of the promises.
I mean, but the other part is also, well, I mean, you look at what the Obama administration is saying, and you've got to take them at their word. They have been very open and honest with the American people about what kind of government they're going to run. They're going to say, like, we're going to have healthcare reform. We're going to pay for it. They also have been saying we're clearly going to address the long-term deficits that we're facing. The first step in that direction is healthcare reform. The second step is ultimately defense reform. And there is going to be a discussion over Social Security reform. There is there's no sleight of hand. There's nothing behind closed doors. This is all in the open, and it's a very accountable argument. So there is a question of ultimately returning to fiscal responsibility after years of irresponsibility. And the other part is making government work much more efficiently than we have in the past.
Dan, quickly, in 10 seconds, your final word. Are they going to get boxed into a corner and be forced to go back on a promise?
the administration increased the long-term deficit estimate by $2 trillion just last month. This is an administration that gave us $800 billion of wasteful stimulus, so-called stimulus. Now they want the government to take over health care. We know that's going to be a disaster. They are setting the stage for being able to claim in a few years, oh, we have no choice but to do this giant tax increase on the middle class.
Well,
Obama shouldn't have continued the big spending Bush policies. That was a mistake.
Gentlemen?
Well, the main issue here is you got to return to fiscal responsibility after years of irresponsibility.
Yeah, so why continue the Bush policies? Cut spending, don't increase.
No, there is a clear break.
Gentlemen, I can tell you our viewers are as passionate.
They're doing the same thing.
As passionate as you are, we are getting a lot of emails about whether that is a tax increase or not. Dan and Christian, thank you.
Thank you very much.
We'll have them back together. Up next on